My name is Amy Barrie and I'm Head of Laboratories at Care Fertility. I'm going to talk about the fertilisation stage of the IVF journey and embryo development and selection. After egg collection, when we have your eggs in the laboratory, they will be visualised under a microscope and prepared for fertilisation. And then, of course, we need the sperm. There will be differences in the type of sperm which will be used. You may be using frozen sperm, testicular sperm or donor sperm. We spin the semen sample in a special solution to isolate the good quality sperm. We then wash the isolated sperm to clean the sample ready for insemination. We have a new technology in the lab called CASA, Computer Aided Semen Analysis. This technology tracks the sperm and tells us how well the sperm are moving, how fast and if they look normal, and it helps us inform which treatment would be the best for you, IVF or ICSI. In some cases, your consultant may recommend the use of a sperm selection device designed to mimic the body's natural mode of sperm selection. These devices rely on the sperm actively swimming through a membrane filter, therefore selecting the most motile sperm. Once the sperm has fertilised the eggs, the number of days an embryo has had to develop before a transfer can affect the chance of success. The longer we leave the embryo to develop, the more information we have about the embryo, and the more information we have to analyse. We're likely therefore to choose a better embryo. If an embryo advances to day 5 or day 6, it's known as a blastocyst. While the majority of fertilised eggs will progress to day 3 of development, only perhaps 40% of these embryos will develop into a blastocyst, so they are considered to be a more select group of embryos with a higher chance of pregnancy. When you're going through IVF, our aim is to select your best embryo with the highest chance of successful development. A healthy embryo has 23 pairs of chromosomes. Embryos containing an incorrect number of chromosomes often result in implantation failure, miscarriage, or a baby affected with a genetic condition such as Down syndrome. We offer PGT-A genetic testing, carefully taking a couple of cells from the embryo and sending them to our specialist genetic testing laboratory to check that the embryo has the correct number of chromosomes. This lets us know that any embryos we transfer are genetically normal. PGT-A testing can't change the number of viable embryos available for transfer, but by transferring only those that have the correct number of chromosomes, the time taken to establish a pregnancy can be shorter, and the disappointment of failed cycles and risks of miscarriage can be reduced. Traditionally, embryologists assess embryo quality using a microscope, but now we have more sophisticated tools to help us select the best embryo. We use incubators that monitor embryo cell divisions in optimum conditions. These incubators have a camera with a unique time-lapse system that continuously captures images as the embryo develops. This can then be used with our unique CareMaps algorithm analysis. Based on the data of thousands of embryos, CareMaps helps us to predict what an embryo should be doing at specific points in time, comparing patterns in development with the data of successful embryos. CareMaps time-lapse embryo imaging is an additional procedure available to all our patients. It can help to make the embryo selection process even more effective, and thousands of babies have been born using CareMaps so far. Our highly skilled embryologists are amongst the best in their field, and we work hard to make sure that our patients always have the option of the latest scientific advancements for their treatment.